Facial disfigurement is probably one of the most serious human problems. It carries with it tremendous vocational, psychological, sociological difficulties. This is true because of what you might call the social significance of the face. After all, the face is the center of individuality. If there's anything wrong with the face, it's always visible. You can't hide it from others. And the individual who is disfigured can't hide it from himself. And that is what makes the facially disfigured an especially handicapped group of people. If I were paralyzed from the waist down, I could be sitting here giving a semblance of normalcy. If I had a badly deformed hand, I could put my hand in my pocket. I could hide it from others, but of course I can't put my face in my pocket. Some of our patients have told us that they go out only at night, simply because they don't want to be stared at. They don't want to answer questions from other people. Many of their deformities are complicated by associated problems of function. Difficulty in vision, in hearing, breathing, speech, chewing or swallowing. This is especially true in patients who require reconstruction after radical surgery for cancer. But we are often able to bring about a tremendous improvement to give the patient a greater degree of normalcy, improvement which permits them to return to normal activity and ordinary social life. In this film, we are concentrating on examples of three major causes of facial disfigurement. Disfigurement caused by disease such as cancer, especially the reconstruction of patients who have massive facial defects caused by radical surgery or radiation. Traumatic defects such as crash injuries and burns and congenital malformations. Now, the two most frequent birth defects we treat are cleft lip and palate and deformities of the jaws. Others include nasal, eye, and ear deformities and disfiguring birthmarks such as hairy nevi.
Cancer alters the lives of thousands of Americans each year. Many victims are saved by surgical advances which now make possible the massive removal of malignant tissue. But often, they survive with gaping facial defects which are repulsive to onlookers and which threaten their ability to work. 10 years ago, this patient underwent amputation of his nose to remove a malignant growth. In his reconstruction, a flap of skin will be lifted from his forehead and swung down, still attached to maintain the blood supply, to form the reconstructed nose. Once the grafted skin takes, the rest of the flap will be separated from the forehead. Some 18 operations were needed over 3 years to complete the reconstruction. With his features now restored, he talks of his experience.
During the course of the operations, I did not lose any significant amount of time away from the office, as I generally was out about 2 or 3 days strictly for recuperative periods. As far as the effect on my work, I generally wore a plastic nose guard with flesh-colored tape, and inasmuch as my work consists primarily of being on the telephone and handling papers, there was no noticeable effect to that extent. My co-workers and my employer were fully aware of my condition, and there was never an issue made over my condition. My family, of course, was of great help to me by giving me mental encouragement, and my children never asked any questions with regard to my condition.
Cancer could have destroyed this man's life. He is fortunate that plastic surgery procedures could restore what disease had taken away. Accidents are a frequent cause of severe disfigurement. Automobile crash injuries present a major reconstructive problem. Often, Shattered windshields literally tear the skin away from the bony structure of the head, and great care is required in closing the wounds to minimize the facial scars. Disfigurement from burns is one of the most painful and difficult human experiences. Large amounts of tissue are destroyed, leaving little skin to graft to the burn area, and reconstruction is a long and challenging process. This young man had a hunting accident at the age of 17. A gunshot wound blinded him and blasted away the middle third of his face. He has already undergone several surgical operations. He has many more to go. He is married and has a 2-year-old child. He tells a medical social worker of his decision to postpone going to law school.
Thank you. I noticed this, that my appearance would often detract from what I'm trying to say. In other words, the person would be more concerned with me than what I'm talking about.
Yeah.
And of course, in trying to be a lawyer, this would be a great deterrent. I'm trying to find a scholarship to go to law school. I hope I can. And mainly, I want to finish my schooling.
The patient has a massive defect in his right cheek, which will be filled during 3 hours of surgery. More operations are planned to rebuild his nose and to correct other defects. But weeks and sometimes months are needed between operations to allow for healing, and only so much surgery can be performed on a patient at one time. Over 18 separate pieces of bone taken from the hip are grafted into the upper jaw to help restore the contour of his face. This patient will be seen at a staff evaluation conference. Present will be all the members of the rehabilitation team.
Next operation, I think, will be start on the nose reconstruction. I think we can do that. There is some work to be done on his lip. You probably notice he has a vertical retractile scar on his the right side of his upper lip. That would be, I think, very simply taken care of by a Z-plasty. And then after that, I imagine that we will probably have to do a forehead flap reconstruction of his nose, utilizing what he has now as a sort of a basis, but adding, of course, what he doesn't have at the present time.
Well, in the reconstructed nose, can you maintain a nasal airway for him?
Oh, yes. Surely. We'll have to open up what he has now, because he's very, very constricted at the present time.
So his speech should remain rather good. There's nothing to preclude it being quite normal.
No, he has no trouble with his speech at all, fortunately. Post-operative course has been uneventful, and he's doing very well. Could we have Mr. Wellman come in, please? Oh, John, how are you?
Fine.
Where are you? There you are. Nice to see you. How's it feel?
Fine.
I bet your hip is more sore than your face. You know, the more you walk after one of these bone graft removals from the hip bone, then the faster the soreness will disappear. How does the face feel?
Feels real good. Doesn't hurt at all.
This young man still has a long way to go in his rehabilitation program. His hopes are high but practical, and he looks forward to his law career. Severe facial injuries are, of course, a great vocational handicap, but industrial and transportation accidents produce another serious problem, that of hand disabilities. Our hands give us a sense of touch and grasp we depend upon in everyday living. For the blind person, they are his eyes. Plastic surgery is often the essential first step which creates the foundation for successful medical rehabilitation. This is discussed by Dr. Robert Beasley.
It is the combined development of the hand and the brain which has led man to supremacy over all other species. The hand must be considered in light of the whole extremity, because if you cannot strategically position the hand, then much of its function is lost. The basic guiding philosophy for all hand reconstruction is to concentrate the available parts into the best working combination. Since the hand is exposed to constant scrutiny, it is important that any reconstructive plans consider both the functional and the aesthetic aspects. In today's competitive society, the grotesque and disfigured hand is as much a liability as the one which does not grasp well.
For the 3 patients you are about to see, the rehabilitation approach differed vastly. But in each case, surgery was performed to simplify the hand mechanism in order to restore the greatest function. This homemaker suffered polio at the age of 5. Despite all treatment and exercises, only 5 of the 40 muscles of her right hand and forearm regained any power. 3 of these muscles were surgically transferred, so all 5 remaining muscles could work together as a simple but effective grasping unit.
Formerly, the index finger and the thumb were both limp, and I call them rather blotto, because they were really not usable. They were just always in the way. I had the use of the 3 other fingers that would grasp something. A casserole was always a very dangerous thing for me to handle. Formerly, when I put a casserole in the oven, I would press hard against the outside of my right hand and lift the casserole and put it in the oven. And frequently, the thumb would catch, or the forefinger would catch on the side of the oven, and the casserole would be in and outside the oven and on the floor. But now, it goes in a normal fashion. Presently, I can hold my cards for a bridge hand between my thumb and index finger as normal people do. And that is a really great achievement. Even my bridge has improved.
This young man was trapped beneath a burning car. His right hand had been amputated and bone protruded from the stump. Injuries to his left shoulder and elbow prevented positioning of the left hand. He was helpless. A series of operations completely remobilized his left arm and hand. Reconstructive surgery on his right arm made it possible to fit him with a prosthetic hand. Without these steps, his handicap would have remained at almost 100%. Today, he is studying for his degree in business administration.
Now I am entirely self-sufficient. I have no trouble dressing or doing anything. I recover the full use of my arm. I expect to finish my studies in 2 years, a year in school. And after that, I plan to go into import-export business.
This is an extreme case involving severe hand and facial injuries from an airplane crash. Reconstruction of his destroyed right hand required a bold approach. Remnants of his fingers must be liberated from the burn scar and repositioned. Joints fused, and thumb dissected free. The entire raw structure was covered with a tissue flap from the abdomen to form a highly functional mitten-like hand. This design was greatly simplified from normal, but is functional and aesthetically acceptable. Today, this man works alongside other people. After being trained in electronics by the New York State Division of Vocational Rehabilitation, he now supports his family. Further surgery is planned to improve his left hand and his facial disfigurement. He is happy with his accomplishments so far and tells of the effect on his life.
Now, it's apparent, I think, to all of us what change it has made in your ability to handle things and hold things. But what's been the most important point of view?
My point is, this is, in one word, back to the life. Before the operation, I was right-hander. I never can use my right hand. I can grab. This way I feel I am not a man. Mentally I was deep down. And I don't like to even do nothing well I can do. And after the operation, when I feel that I can grab, I working, I take hacksaw and cut something, I am back to the life, I am happy.
Well, we know that this has made a difference in your ability to work, but what has it done to your home life and to your life as a whole?
In home life, maybe more than in factory. At home, I don't need a second person who helped me. This way I am not handicapped. I feel I am happy. My family is, I am a man in the family. That's it.
This man has achieved the dignity of being self-supporting, of contributing to his community, of the man of the family. The third major area of this film deals with the problem of birth defects. The birth of a child is always a great tragedy for the family. Parents may have feelings of guilt or inadequacy, and they must have reassurance that they're not at fault. The cause of such deformities is not yet known. The disfigured child wants to be like all other children, to enjoy child friendships and the love of his family. So special care is needed to avoid rejection of the child who is different. The most common malformation is the cleft lip or hair lip, which occurs in about 1 out of 750 births. It is frequently accompanied by a cleft of the palate or roof of the mouth. The cleft lip can be repaired a few weeks after birth. In this procedure, the surgeon brings the two parts of the lip together in such a way as to minimize scarring and to restore the contour of the lip.
Mary Ellen was my 7th child, and all of my other 6 children were perfectly fine in every way. And the day that I can remember, right after she was born, my husband coming in and seeing me, and he was told to tell me that everything just was right. Everything just wasn't perfect. I can remember the expression on his face and being terrified, just terrified. And then they took me down to, he wheeled me down to see her. I looked at her, and the feeling, the main feeling was one of protectiveness. Your heart just breaks when you see someone, your child, that God has given you to take care of, face life with everything that isn't just perfect. And all I could think of was, what can I, what can I do for Mary Ellen? You just can't imagine the feeling of wanting to save this little girl from all these looks of disdain or ridicule that she might face through the years. And you just can't imagine when you see her that everything ever will be right, perfectly right for her, like all the things that all mothers and all fathers want for their little girls and boys. Well, now Mary Ellen is 3 years old. She's had 2 operations. She had one when she was about 2 months and another when she was 2 years. And actually, she looks very wonderful. And through the years, she might need more. And by the time she gets to school, actually, when she starts kindergarten, she shouldn't look any different from any other little girl. And then by the time she starts dating, when she's in her late teens, she will be just as pretty as all my other children.
Mary Ellen can grow up normally. She has the security of her family's love and devotion, which all children, and especially those who are deformed, so urgently need. Correction of the protruding jaw with its loss of dental function calls for the close collaboration of the surgeon and orthodontist. In the repair of this patient's condition, small incisions were made below the vertical part of the mandible or lower jawbone. This part of the jaw was separated surgically and the rear segment pulled aside enough so that the front portion could be shifted back to its new position. An orthodontic appliance kept the patient's jaw position fixed until the separated bone had healed and grown together permanently. The patient was later seen at a follow-up clinic.
What do you think about the change in the appearance?
I think simply marvelous, and I don't know if my mother will recognize me. She has never seen a picture of me since I had the operation.
I see. What are you doing in this country?
I'm a nurse, and I'm taking out my master's in medical surgical nursing at New York University.
I see.
Such a remarkable change can alter the entire course of a life. Now you have seen the tragic problem of disfigurement from cancer, from crash injuries and burns, and from birth defects. You have also seen the plastic surgeon's ability to restore. The reconstruction of such patients places a tremendous responsibility on the rehabilitation team. But an even greater burden rests on the patient, who must have the physical and psychological stamina to see him through his ordeal.
The problem in some of these patients is to bring them to a slow realization that although we can bring about an improvement which may be tremendous, we often cannot always restore the patient to the status quo before the accident. You must remember that the great strength of the patient is the element of hope. He hopes, of course, to be rehabilitated, but there are moments when things look pretty discouraging. And a lot depends on the proper psychological handling. Those who surround the patient, if he has, for example, an understanding family, understanding relatives, understanding wife, these are some of the factors that are very important and must be taken into consideration. Many of these reconstructive problems require a whole series of major and minor operations. And managing the cost of hospitalization can also be a problem. For instance, in reconstructing an ear, some 6 or 7 operations might be needed over a period of a year. A challenging problem such as this extensive hairy nevus covering a major portion of the face may require 15 to 20 operations over a period of 8 or 10 years, involving the rotation of skin flaps from other parts of the face and neck in order to match as closely as possible the color and the texture of skin.
Today, there are less than 1,000 surgeons certified by the American Board of Plastic Surgery, meeting the needs of nearly 200 million Americans. An organization deeply concerned with this problem is the Society for the Rehabilitation of the Facially Disfigured. The Society's chairman of the board is Thomas Darcy Brophy.
There is a tremendous need today for more trained reconstructive plastic surgeons. That is why a major effort is being made by our society to support programs of training. At the present time, we aid at clinic and training programs in New York City, at University Hospital, Bellevue Hospital, Manhattan Eye, Ear, and Throat Hospital, and developing from these programs are teaching affiliations with Memorial Hospital and with the Veterans Administration hospitals. Through these programs, we hope to train reconstructive plastic surgeons who will go out to other parts of the country to establish their own for treatment of the facially disfigured. bringing the team concept of rehabilitation to many more patients throughout the nation and the world. Most important of all, we want to create a greater public awareness of the problem of facial disfigurement and what can be done today to help those suffering from this human tragedy. With such understanding, major progress will be made in this new field of rehabilitation, and thousands more who are facially disfigured can be helped back to normal and useful lives.